Julia Hartley Brewer sat down with the Queen of Evil and finally said to her what most of us have wanted to say to her for a very long time now.
They were now joined by the founder of Gender GP, Dr. Helen Webley, live in the studio. Good afternoon to you. Thank you so much for joining us in the studio.
My pleasure.
Always grateful for that. I wanted to talk to you. You've been quite busy on social media. You've responded to a few of the posts that I've made on issues related to trans issues, and in particular, we had the publication of a draft bill last week by the Equalities Minister Olivia Bailey about a draft bill to ban conversion therapy, not just gay conversion but also trans conversion therapy. And basically it could mean, many are warning, the campaign is warning, that parents, teachers, therapists, doctors could risk up to 5 years behind bars if they try to talk children out of irreversible trans treatments, including puberty blockers. And I want to talk to you because you run a business selling puberty blockers to children.
Well, I don't run a business selling puberty blockers to children, so I think we just need to clear that up.
What do you do then?
Children don't need puberty blockers. Adolescents have puberty blockers once they've started puberty. So if we just clear that language up, because that's
Adolescents are...
Adolescents are young people who have started puberty.
Adolescents,
so
under 18?
Teenagers,
Under 18, so children.
Yeah.
Well, it's a technical term, children.
For the medical term, children is a very emotive term, so children don't need puberty blockers. And let me just be clear, I don't sell puberty blockers
to children. They give them for free?
Because actually young people in this country can't access puberty blockers. So
there's a few things to unpack there. You're going to see Helen do this a lot during the interview, where she challenges language and tries to reframe it. But in reframing it, she just affirms what has actually been said, but uses slightly different labels. So what she did there was she said that it's not children, it's young people that are teenagers. If they're under the age of 18, certainly 16, they're children. But the word children, and she's right, it is emotive language, but it's truthful language, and that's one of the fundamental things here that needs to be altered is truthful language. It's the term Orwellian is overused these days. If we look at the defining component of a 1984 story, it's this idea that the state can compel you to think something that is not true. And this is central to the gender ideology. You have to, I call it adult Santa Claus, where we say, oh, Santa Claus is real, is he? Yeah, he's real. You have to believe that male can be female and female can be male, which is fundamentally untrue. This is not possible.
The doctors...
To under 18s.
You want me to answer or you don't want me to answer?
I'm trying to clarify your answer.
And I'm clarifying with you that you introduced me to the world as somebody who runs a business selling puberty blockers to children. And I'm clarifying to you that that's not the case.
You're no longer involved in the business.
So did you want to move on to the conversion?
Yes, I'd love to, but I don't think if we are clear about this, but yeah, you're right. Let's move on.
It's unfortunate for Julia here that she has to, with these types of interviews, they're not as good as the long form podcast stuff, and they definitely suit the likes of Helen much better because Julia, she's got a certain amount of time where she can only, she can only work within that time. They can't speak for 3 hours. They can't go Joe Rogan, which is a shame because she has to move on. She has done a good job there at trying to pin her down, saying, sorry, have I missed the point? You give them out for free, do you? These young people that you describe as being under 18s, you don't call those children. And Helen is obfuscating and she's deflecting and she's avoiding. And Julia sadly does have to move on.
This new law, do you think it's right that a parent, I've got friends who've gone through this, that a therapist who is dealing with a troubled child, a confused child, a child who may be autistic, or may be, as we know from the Cass report, may be gay and uncomfortable about being gay, or in a family where perhaps one of the parents disapproves of homosexuality or for some reason. Do you think that a parent or a therapist trying to talk that child out from doing something like taking puberty blockers drastically altering their body, that they should face up to 5 years behind bars?
Your language is so emotive, though, isn't it? Because you started by saying that the draft bill was about banning conversion therapy for gay children or transgender children. And that is absolutely right, because conversion therapy is a form of therapy which prefers the outcome for that gay child not to be gay or that transgender child not to be transgender. And that's not good therapy. I mean, preferring an outcome that denies somebody's true identity is not helpful to anybody.
Well, I mean, completely. I don't think there has actually been a big issue in this country with even gay conversion therapy.
I think one of those tragic components of this ideology is somehow we've landed on affirming to a child that the way they are is imperfect and wrong. And conflating it with sexuality is very sneaky, because obviously if a child is gay, there's nothing they can do about that. And why should they want to do anything about that? And that's fine. Obviously, it's fine. Nobody has a problem with that, or, you know, almost nobody has a problem with that. There's enough people in the world that don't have a problem with it for it to no longer be a problem. But what they're doing really sneakily is they're conflating sexuality with gender. And they're saying that if this child wants to present as the other sex, that by saying to them, no, sweetheart, there's absolutely nothing wrong with you as you are. There isn't a hair on your head that's out of place. You don't need to take drugs to change your appearance. There's nothing wrong with you. You're absolutely fine. That is a very different message, isn't it? To saying to a kid that's gay, you're not gay, and we're gonna put you through therapy to make sure that you're not gay. Two very different messages. Actually, by affirming to a child, yeah, there is something wrong with you. Yeah, you're in the wrong body. Whatever the phrase is now, it's not that anymore, apparently, according to Helen. But whatever such phrase that means the same thing. We need to put you through surgery. We need to put you through medication. We need to put drugs in you that later on in life are going to cause you to be sterilised, give you issues with your bone health, put you at higher risk of things like heart attack. Because by pumping these hormones into your body, we are making you far less healthy than you are. There's nothing about a person's sexuality by just a person being gay. There's nothing about that that's going to make them less healthy. But it's not the same for trying to change someone's sex, which is immutable and impossible to do.
It's a big thing in America.
Well, you may not know, but there are plenty of LGBT people who have been through conversion therapy, whether that's full-on elastic bands, vomiting, prayers and what have you, or whether it's subliminal preference that the better outcome, which
would
I
be
think
that
is
you
what
were not. Yes, I mean, I wouldn't be if it was my
towards.
daughter and she said she was trans. I wouldn't have a subliminal view on this. I'd have a very clear view on this.
Well, then I feel sorry for your daughter then, if your daughter was trans.
Yeah, well, I would feel sorry. I think one should show nothing but kindness and respect and sympathy to people who do believe this. So
Sympathy? Why sympathy?
Because
sympathy. We should be embracing queerness. We should be embracing.
I'm afraid. I'm from a generation where that was used as a term of abuse against gay people, so I choose not to use that word ever. I don't know what that means. Queerness, trans, these are very different things. So I want to clarify. Do you believe that there are, because I don't believe there's any such thing as a trans kid, right? So do you believe that there are children...
So you don't think that the Equality
let me ask a question.
No, because I can't just let you say I don't believe that
I can say
on.
yes.
Yeah, but I can interrupt.
Okay, yes.
So you don't believe there's anything such thing as a trans child. So the
No,
Equality...
I know there isn't.
Okay, you know there isn't.
Yeah.
But the Equality Act actually has a protected characteristic, which is somebody who undergoes gender reassignment.
That doesn't mean they are trans. No.
It doesn't... So you're basically saying...
No, there is a protected characteristic. It doesn't mean that they actually are trans. That's what I want to ask you specifically. Do you believe that there are children who are born in the wrong body?
Born in the wrong body. Again, it's just... Julie, you need to really watch your language. This is
don't tell me what language to use. That's not going to go down well for you, Helen.
I just did. Transgender children exist. There are
children who
people...
believe that they're born in the wrong body exist.
I didn't say they're born in the wrong body because it's such an
That's why I
offensive
asked you
thing
that
to
question.
say.
What's the motive? That's
We were
what a lot
talking
of
about the Equality
That's what a lot
Act.
of children say. That they're born in the wrong body.
No, they don't. People
Well, that's
like
what we're
you
told by
label us
that's
them.
what trans activists constantly say. People feel they're born in
Well,
the
then
wrong
you need
body.
to watch me a little bit more on social media.
I'm
because
good. I won't need to do that.
Okay.
Okay. So you don't think that phrase is? You don't think that is
Nobody's
meaningful?
born in the wrong body. What an offensive thing to say.
You accept that? Okay. So no, I was going to say you're a doctor by training. So that's basic biology. So what is it that a trans child believes or is, in your view, that is different from any other child? If you've got a little boy or a little girl who says, I believe I'm trans, I believe that I am a girl or a boy, the opposite from what they have been, I don't believe in assigned at birth, which for what they are, what is it that's different about them?
Well, the belief is not their belief. Their understanding is of who they are. It's your belief. You believe by looking down there that that is a little boy, and what
I believe
you're
that someone with a penis is a boy.
Yeah.
And I'm mistaken in that.
Would you like me to finish or
Okay,
not?
just clarify.
Okay. So you believe by looking at a penis that that child is a boy.
Yes, I do.
But that child may well be saying to you, you've got it wrong, your belief is wrong. Actually, inside my soul, inside my heart, inside my brain, I'm a girl. And people like you who deny that do an awful lot of harm. And people like you who put that out there on big social media channels do ever such a lot of harm to those people who are transgender. How do you know what you are? Do you know. Or is it that you just
I've
know?
known all my life. I was given female on my birth certificate because I haven't got a penis, I've got a vagina. Given birth, I've got pregnant and given birth to a baby. I think the evidence is very, very, very clear that I'm a woman. I've never questioned that. The vast majority of people don't question it. And until very recently, before this started being pushed as a political agenda, very few children question it. Now, here's the thing.
Yes, they did, if I may. And actually, we understand it so well that it isn't in our UK law. And do you think that your womanhood is dictated because somebody else put female on and
No,
because somebody
because
else
I am female.
made you pregnant, got you pregnant, and then that makes you a woman? I mean, I don't think we should
I am female
women.
because
Yes.
I am female.
Yes, and that's
because I actually am.
Exactly.
And I can think.
Exactly.
I can think that I'm
You've got it. You've got it.
I can think that I'm a German Shepherd dog if I want, but it doesn't mean that I am.
German Shepherd is a dog. We're talking about human identities here. Spider-Man climbs up buildings. Dogs are a different species.
You believe that it's wrong. So if a child says, whether it's a patient, whether it's a child to their parents, says, I know I've not got a penis, but I believe I am a boy, that should be affirmed. That is clear to me. It's gender dysphoria. It's a mental health issue. We know from the Cash Review...
Are you a health specialist? Is that your excuse me?
She's going to do this a lot. She's going to claim to Julia that she can't possibly understand medical information. And essentially, she's going to question, the ability of Julia and then by extension other adults to understand, medical information and medicine. But she's then also going to, in the same breath, a little bit later, she's going to say, well, of course children understand this. Of course they understand all this medical information.
No, I'm not going to get away with that because...
You can at the end, let me quote...
There will be transgender people listening to this.
Yeah, and they can listen to it.
And listen to you saying that they have a mental illness.
Cash Review was carried out by one of the leading paediatricians in the country. It's been widely accepted.
And widely discredited.
It has not been remotely discredited. That is simply untrue. The Cash Review made it very clear, and this was something that was widely available as evidenced already, that the vast majority of young people who not just attended the Tavistock Clinic in London, but also other transgender treatments, that they are children who have they're either autistic, they're gay children, they have other issues, lots of other mental health issues, depression, anxiety, some have been abused, lots of other issues. Is it appropriate to affirm, in your word, their mistaken view, in my view, that they are, whether we use the phrase born in the wrong body, or that they are the different gender from what has been assigned at birth, and to give them a treatment, not just say, yes, you can change your name to Jane or John or the other way around, but to give them a treatment which prevents the normal, natural, timely development of their bodies?
Well, I just want to say to all the transgender people who are watching this show that you don't have a mental illness. And what I would like to
Deflection?
Mental health problem.
OK, I'd like to say to all of the people who listen to this, are listening to this show, all transgender people, that just because you are transgender does not mean that you have a mental health problem.
The biggest review carried out by a leading paediatrician in this country looked into this and repeated evidence that is very, very clear again and again that actually the vast majority of children who appear at clinics who claim to believe that they were born in the wrong body, or whatever phrase we want to use, have actually got other issues, which perhaps more of a bigger explanation.
Okay,
and
so
the vast majority of the children who, if they're left to their own devices, either, quote, grow out of this, go and live a perfectly happy, healthy life as gay men or lesbian women, and And I'm going to say, how can you justify giving drugs to change children's bodies, and they are children who are under 18, especially when we know that puberty blockers have not been used by the Tavistock and elsewhere as a way of a pause. We're talking a pause to have a think. Whereas, in fact, more than 90% of the children who are given these drugs, or the young people given these drugs, go on to take hormones to actually, try and sex change hormones, and leaving them often infertile. With no.
You're very medically aware
no
here.
sexual
Absolute
function.
Rubbish.
I'm talking about
Rubbish.
me.
And I'd like to say to all the parents of transgender children who listen to your show and hopefully don't watch your stuff on social media, that their children are not a problem. Their children are absolutely right to live happily and
I'm not asking. I don't want anyone not to live happily.
And
classic deflection again from Helen. She doesn't address anything. She doesn't come up with it. There's no substance. Whenever she's challenged with, by the way, facts. And if, depending on how much you want to learn about this, if you one of the best books is Trans by Helen Joyce. One of the few but well orchestrated large scale studies of children that were questioning their gender. What they found was, in time, they did grow out of it. Now, there were a small percentage that didn't, but well into the 90s, like over 95% of the kids that were tracked grew out of this phase and continued to live happily ever after, usually as gay or, whatever. The reason the statistics these days don't show that is because we medically intervene when they are children. They're not given the opportunity to grow out of it. But what Helen does here, which is what she always does, is she appeals to the emotion of the parents or the children. There is nothing, she doesn't address in any substantive way what Julia is putting to it. It's very frustrating.
Can you address my point?
And actually, no, they are not gay. If your child is trans, your child is trans. Nothing to do with their sexuality. And no, they are not
Cass'
all.
report was wrong.
And no, they are not all victims of sexual abuse.
I didn't say that. I never said that. I didn't say that.
Well,
I didn't. I mean, I
we'll
literally didn't. You're just
rewind.
making it up. No, I didn't.
You haven't mentioned those words today.
No, I didn't say they're not all. I didn't say they were all. One of the things that Cass reviews.
List.
I said
Yeah, and I'm
that
just
the
saying to the
majority are
parents.
blah, 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 and one of the things that was listed was victims of sexual abuse.
And the only one you don't list is true transgender children.
What does true transgender children mean?
It means that somebody else put female on their birth certificate.
And they're not.
And they're not. Exactly.
What's the youngest age that your business that you founded, along with your husband, who I believe has been struck off as a GP, you're no longer registered, but you are, you're a doctor. You no longer have a license to practice. That was your choice in this country. What's the youngest age at which puberty blockers have been given to an under 18 child, as I'm going to use that word, by your company, Gender GP?
The appropriate time to give puberty blockers is when puberty starts.
So what's the youngest age?
The youngest age for puberty blockers, I mean, some children at the age of 3 or 4 can start puberty, and we give them puberty blockers.
That's different. That's a medical treatment.
Oh, that's a medical treatment.
That's a medical treatment.
Dom's back in again with now
no, that
a
is,
medical
that
treatment.
is literally what that is for. It's not for a trans child.
Oh, I see. That's for proper
Are you under the
needs.
illusion? Are you under the illusion that people who don't have a medical degree are incapable of reading what medical experts say?
Well, interpreted.
You think I've wrongly interpreted? So when children are given puberty blockers for precocious puberty at an inappropriate time to slow their body down, to
By the way, precocious puberty is a well-known disorder, I guess, for lack of a better word, where children, for whatever reason, start puberty at an extremely unnaturally, wildly young age. And so puberty blockers, in that instance, is an appropriate treatment because it's treating early puberty. It's a very different thing to giving them to a perfectly healthy child to restrict or slow down or stop, prevent puberty from happening when it would otherwise naturally do so at a natural time in that child's life.
They enable them to develop naturally. That is a medical treatment as opposed to a preferential treatment from a child who believes that they are trans. You understand the difference?
You're so cruel.
I'm cruel now. Helen, I just asked you before we went to break, I want to ask you, what is the youngest age that you have given, your company, Gender GP, has given, sold, I mean, I don't think you give them away for free, puberty blockers. You said youngest could be age 3. What is the youngest age, as far as you're aware, from the company you founded?
Well, we've been struggling with the terminology. The terminology is that doctors prescribe puberty blockers for young people who need them. So
I'm asking your company.
Yes, and the doctors will prescribe puberty blockers for children who've gone into puberty puberty, whether that's precocious puberty or whether that's for transgender
What's the youngest
children.
age a child that hasn't gone into precocious puberty
When
has been given
puberty
them?
starts, so puberty is in people for trans reasons.
But the reason
for
they want them-
transgender young people entering puberty.
What age?
So people with ovaries can enter puberty as early as 7.
Why can't you just answer the question? What age?
We didn't even say 7 then?
No, but you're talking about precocious puberty.
No, I'm not.
Then. So you're saying
puberty can start as young as 7, 8, 9.
Yes.
Okay?
So you're saying that your company has given puberty blockers. I didn't ask about doctors. I asked you about your company.
But a company can't sell
The
or give.
people working for the company that you're the founder of.
The doctors.
The doctors, yeah.
Working
What's
with
the
gender
youngest
GP.
age they've given them to?
I just told you, 7
years
8,
old.
9, 10, whenever puberty starts.
Okay, and is that for trans, because the children,
transgender people?
That's for 7 years old. And your company has been criticised by a senior judge, it wasn't a party to this particular court case, for not informing young patients about the risks of things like the train they're getting onto the train tracks. Sorry, I'm so sorry. I'm going to be, quoting some of the risks there are: infertility, sexual dysfunction, bone density damage, brain developmental risk. Now, a lot of that comes from further down the line, but we know the evidence is clear. Don't have a medical degree, but the evidence is clear. Read the reports, see what the medical experts who do know say, that actually the vast majority of youngsters who start on these puberty blockers move on to cross-sex hormones, and that's what the reaction is. How can a young child, how can anyone under the age of 18, how can they make a decision about their future like that?
I think we have to give young people credit for understanding a lot of things in healthcare. So whether it's...
Remember when she said to Julia that she doesn't understand and that adults are incapable, by extension, of understanding medical information? But children understand it just fine.
Going in for a broken arm, whether it's going in for your adenoids, whether it's going in for grommets, whether it's going for puberty blockers, whether it's going for open heart surgery. You have to understand that parents and children make decisions
But a
for
lot
medical
of that
care.
is medical
And
treatment
that
for a problem.
And the problem is gender incongruence, gender dysphoria, development. And the reason that we got into this discussion here today was because of this campaign.
You're wearing a T-shirt. Oh gosh, yes. Proud of my stripes.
Yeah.
This is a lush campaign, and it's got a tiger apparently celebrating having mastectomy scars, cutting off perfectly healthy breasts.
Proud of my scars. Yeah.
It's so evil. It's so evil. It's so despicably evil. What on earth will they think of us in 500 years' time? Those that said nothing. Those that allowed this to happen. Well, the most delicious moment of the entire interview is coming up.
And actually, do you know
repulsive.
What? Yeah, but
that was what you were wearing. It literally makes me want to vomit.
Or would you like to... Can we have a bucket in here, please? But puberty blockers prevent this. So on the one hand, you're saying puberty blockers, you could give them to anybody else, but not for trans things, as you say.
Well, for non-medical reasons.
And yet, actually, that puberty blockers prevent breast development in transgender boys.
Her perfectly healthy breast on a girl who needs her...
Well, you're again misgendering every single transgender boy out there.
I am so frustrated it's 12:59 because I was wanted to ask you whether if a troubled child came to you as a doctor with anorexia, believing she was too fat, would you affirm that and help her lose more weight?
Are you really asking that?
Yeah, it's the same thing. A child that thinks they're the wrong sex, or a child that thinks...
People shouldn't get too involved in medicine because of the harm you cause to people who listen.
I think, and I mean this very respectfully, I think people like you should be in prison.
I hope the needle is moving on this. I think the hardest thing with this ideology, and it's the same whether it's trans ideology, whether it's climate change, whether it's coronavirus, whatever it is, each of these things have a pre-established a position that is pre-approved rather, and people that simply are willing to toe the line and say what they need to say and espouse the correct pre-approved opinion aren't interested, and neither do they need to be interested in digging deeper and asking difficult questions of this ideology. Because essentially all they need to do is repeat it and parrot it and say, trans women are women, and climate change is real, and coronavirus was caused by a bat having sex with a pigeon, or whatever it was. On the transgender issue, you'll hear, when you ask questions like really simple questions like, did you go to school with anybody that was transgender? And they'll say, well, it was less accepted then. It just wasn't as accepted then. That just doesn't hold water. It doesn't hold water at all. Because we've lived. I mean, I'm 36. This is the most progressive era in the whole of history. And I did go to school with kids that turned out to be gay. And guess what? Nobody gave a shit. Nobody cared. But nobody that was transgender. And I think the real kicker for transgenderism is there are detransitioners. There are detransitioners that have gone so far down the process. They've had breasts removed. They've taken medication that makes their vagina permanently dry, for example. And it causes a lot of discomfort and pain. Their voice is permanently changed. And they've realised, fuck, I didn't want to do any of this. I shouldn't have done any of this. And they are really inconvenient for the trans cause. And by the way, if you bring those up to people that are... Because you've got to understand that most people that espouse these views are very surface level. If you're somebody like me that wants to challenge it, you better have your facts straight. That's all. The only advice I can give is you better know what you're talking about, because they have all of the establishment and the institutions on their side. So when it comes to this issue, they don't need to know the detail. They don't need to be across the detail. They don't need to have any kind of intricate knowledge of the situation or of the subject. They just need to essentially toe the line, say the right things. It's all very superficial and surface level, and they don't need to worry about the fallout because they've got the backing of the institutions. They've got the backing of kind of mainstream culture. Although lots of people are like, hang on a minute, this doesn't pass the sniff test. But my point is, for people that are only involved in this in a superficial level, and even the ones that are vocal only have a superficial understanding, the detransitioners are really inconvenient, because these are people that have been through all the medication and they've been affirmed, and they'd have had lots of yes men around them and lots of people encouraging them, lots of these superficial people that you deal with on a daily basis, that I deal with on a daily basis, encouraging them to go through with this, that now are mid-20s, late 20s, and are like, hang on, I've maimed my body for the rest of my life, and it's irreversible. I can't get my breasts back. I can't have a baby now. I don't have the voice that I had when I was younger. It's all gone. The point is this: have the courage to challenge it. It doesn't mean you need to be cruel to people. It doesn't mean you go out your way to be horrible to people. It doesn't even mean that you go out your way to challenge it for the sake of challenging it. But certainly don't be afraid of taking a position that is contrary to the status quo.